So this is ADC webinar 170, Suturing Techniques and Oral Surgeons Way, to be presented by Dr. Shruti Vichare. So let me introduce Dr. Shruti. Dr. Shruti N. Vichare is an oral and maxillofacial surgeon, completed her post-graduation from MGM Dental College and Hospital, Navi, Mumbai. She works as a consultant and well-versed with minor and major oral surgical procedures, ranging from difficult extractions, implant placement, sinus lift, oral pathologies, maxillofacial fractures to diagnosis and treatment planning guidance of oral and maxillofacial oncology cases also. She has publications on topics like traumatic optic neuropathy in orbital wall fractures and glandular odontogenic cyst mimickers during her thesis. Additionally, she also has presented lectures at BARC Convention Center and dental implantology workshops. She also has presented topics like medical emergencies in dental practice and pharmacology. She has conducted several one-to-one lectures with hands-on topics related to oral surgery. So today she is going to teach us suturing techniques along with explanations to suture materials also. So everyone join as fast as possible. If you have any questions, you can put it in chat box or ask it after the presentation. In between presentation, please keep everyone on mute yourself and cooperate to all of us. So welcome, Dr. Shruti. Over to you, please.
Thank you, Dr. Sudhir, for a beautiful introduction. So I hope I can start with the presentation now.
Yeah, sure, you can start.
Okay. So I welcome each one of you to this presentation of suturing techniques in dentistry. So as Dr. Sudhir introduced me, I am Dr. Shruti Vichare. I'm an oral and maxillofacial surgeon practicing in Mumbai. So I would be sharing my knowledge of suturing in dentistry with you all. So I'll proceed with the presentation. So this is our content for today, okay, ranging from historical background to different, knotting techniques and different devices that are used for suturing and techniques. So to begin with the historical background, I would just give a glimpse of historical background first at the beginning of the presentation. So the first mention of sugars of the sutures is heads back to 16th century BC by Edwin Smith Papyrus. And earlier, there were different suture materials used, like ranging from horse hair, pig bristles, etc., etc. Gold, silver wires were used. Gut was used. Gut is still in use. Linen is still in use. And there were various sutures obtained from tendons and intestinal tissues of various animals earlier. Okay, so with a lot of lot of changes, a lot of modifications. Currently, we have some refined variety of sutures with us. In 1900, catgut industry was first established by Germany, and later in 1902, Claudius was the one who came up with iodine sterilization of catgut sutures because there was a lot of reaction and all happening in the sutures. So there was first sterilization of the sutures performed.
Listening to me?
Now starting with the, sorry.
Are you listening to me? Your
So
is visible. Please share your screen.
It is not visible?
No.
Okay, one second.
Please share your screen.
Okay, I'm sorry.
No problem.
Okay, so
it is not visible now also. Share your screen. I mean, for participants only.
So already actually.
Anything. Now it is visible, but still the.
Is it visible now?
Yeah, visible.
One second. It is visible? Okay.
Yeah. Go ahead now. Sorry for
interrupting. Great. No problem, no problem. Okay, so this is the content of my topic, as I mentioned, which would be ranging from historical background to different suturing techniques. So starting with the historical background, as I already mentioned, the first mention of the suture was in 16th century BC by Edwin Smith Papyrus. And earlier, there were various suture materials used, like horsehair, pig bristles, gold and silver wires, and gut, which is still in use, linen, cotton, tendons, and various, sutures were formed out of tendons and intestinal tissues that were obtained from various animals. In 1900, catgut industry was established in Germany, and in 1902, there was Claudius, a person named Claudius, who came up with the iodine sterilization of the catgut sutures. So that is where the sterilization of the suture was introduced. Okay. Now coming to the classification. Now I have generally observed that there is a lot of confusion in general when it comes to classification of sutures. So I have given two different classifications of sutures for ease of understanding. So the first one broadly divides the suture materials into two parts, that is absorbable sutures and non-absorbable sutures. Absorbable sutures are further divided into braided and monofilament sutures, and non-absorbable ones are again further divided into braided and monofilament. So under braided absorbable sutures, we have surgical gut, we have Vicryl. Under monofilament absorbable sutures, we have monocryl, PDS, and Teflon sutures. Under braided non-absorbable sutures, we have silk and polyester sutures. And under monofilament non-absorbable sutures, we have steel, nylon, and proline sutures. I would be explaining each of this, so you don't have to worry in case you don't understand right away. The second classification is also broadly dividing sutures into two parts, that is absorbable sutures and non-absorbable sutures. And absorbable sutures are further divided here into synthetic and natural sutures, and non-absorbable ones are also divided into synthetic and natural. So under synthetic absorbable sutures, we have monocryl, Vicryl, PDS. Under natural absorbable sutures, we have surgical gut. Under synthetic non-absorbable sutures, we have ethylon, proline, Teflon, and polyester. Under natural non-absorbable sutures, we have surgical cotton, silk, and surgical steel. Now we will get acquainted with the terminology that is associated with sutures, which is, despite being easy, is sometimes a little confusing for the clinicians and students. So let's start with the terminology one by one. So first, coming to absorbable sutures. So basically, absorbable sutures, as the name suggests, are also called as resorbable sutures. And as the name suggests, they get absorbed or they get degraded in the body over a period of time. So that degradation can happen either by the enzymatic process, or it can happen by the hydrolysis, by the tissue fluids. Okay. As mentioned earlier, they are broadly divided into natural and synthetic absorbable sutures. And time of resorption is very, very crucial thing that you have to remember about absorbable sutures. And on average, it lies between 1 to 8 weeks. The general advantages of all the absorbable sutures are they are broken down by the body. Hence, there is no foreign body that is left behind. Correct? And the disadvantage is, you need to understand this point well, consideration of wound support time. Since the sutures resorb on their own, and since we are not removing the sutures, there is a tendency or there is a possibility that sutures can get resorbed before the wound healing is complete. So wound support time is the time required for the wound, the time of the support required by the wound to completely heal, the support that the suture offers to the wound for it to completely heal, right? So since they resorb on their own, there is a possibility that the suture can get resorbed before the wound healing is complete. So here is where meticulous knowledge of suturing comes into picture. So you should be well aware with the resorption times of the sutures and the wound healing time of various tissues that you're dealing with. Okay, so you can combat this disadvantage of absorbable sutures, correct? Moving on to non-absorbable sutures, they cannot be digested by tissue enzymes, nor can they be hydrolyzed in the body, correct? Because they are non-absorbable or non-resorbable. So what happens eventually with these sutures? They get totally encapsulated by the body. So body tries to encapsulate them and they get totally walled off. Although they are non-absorbable, 50% of their strength is lost at the end of like 6 to 9 months. So they really don't offer wound support after around approximately after 6 months. So they'll just remain in place, but they will not offer any wound support after that. Okay. Now coming to the advantages of non-absorbable sutures, they offer permanent wound support. That is what they've said. but I would say that over a period of time, the tensile strength of non-absorbable suture also decreases. So there is no concept as permanent wound support. Okay, but obviously it will be more than the absorbable sutures. Correct. Having said that, we come to the disadvantages. So foreign body is left in the body. Correct. Even if it is not offering any support, it is still in the body forever, more or less forever. And suture removal is necessary. Okay, if you don't want that foreign body to stay in place and if it is not degrading on its own, you have to get it out, right? So it can be sometimes discomforting and a little inconvenient. Chances of wound sinus formation are more because after all, it is a foreign body. At any point of time, it can have a foreign body reaction. There can be suture extrusion taking place, right? Now coming to monofilament sutures, that is another term which is very commonly associated with sutures. So monofilament, what is the meaning of mono? Mono means one. So there is one filament that is involved in constitution of the suture. So it is made up of one single thread. So now what is the advantage of it? Now I want you to very carefully look at the picture which is given on the right side. The surface of this suture is very smooth because you don't have multiple filaments coming together and constituting the suture. The surface of the suture is extremely smooth. Hence, what happens is this particular suture is very smooth. It passes through the tissue very easily, and also the chances of slipping of the suture through the tissues is more. It is very very smooth. The passage is very smooth. Right? Also, very important thing based on its smooth surface is since this particular suture does not have crevices and interstices, bacterial harboring is next to nil in these type of sutures, right? Another important thing that I have to mention about these sutures is it is very delicate to handle. Okay, these sutures are very delicate to handle, and being monofilament, the friction, the surface is smooth, therefore the friction is less, and hence the knot tying of these sutures is little problematic at times. So you have to tie multiple knots to have a good secured suture in place. Okay, so that is one thing. So one thing again, I'm repeating, since this suture has a smooth surface. It does not have crevices and it does not have interstices. Bacterial harboring is next to nil. All the more since it is very smooth and all, the slipping chances of the suture through the tissue is very common, and hence a lot of these sutures are very technique sensitive and a lot of skillful handling of the sutures is required. Multiple knots are required, correct? So coming to advantages of monofilament sutures, they provide smooth passage through tissue, so the friction is not present. So tissue drag and trauma is also reduced, correct? Smoother the suture, obviously the trauma that is offered to the tissue is less. It is resistant to microbial incubation because it is smooth, right? Disadvantages would be special handling and tying is needed. So you have to be a little more careful and a little more skillful for using these sutures. Also, the knot tying becomes a little difficult because they are very smooth, and one, two knots, maybe you will require two, three more knots to secure them in place. Correct? Coming to multi-filament sutures now, multi means many, right? So you have multiple similar filaments coming together and forming this suture, right? So basically now these sutures are broadly of two categories. Braided ones, that is multiple filaments are braided together to constitute this suture, or you have multiple filaments twisted together to form this suture, right? Fair enough. Now, as you can see here, this is the schematic representation of the suture, and this is the actual microscopic picture of the suture. So if you can see here, you have these interstices and crevices and grooves and niches present on the multifilament sutures. So they give a very good environment for bacterial growth. Okay, right. All the more because of this rough surface, the friction and passage of the when the suture is being passed through the tissues is a little more. Okay, but having said that, the advantage of the suture is that the handling of the suture becomes easy. You don't have to tie multiple knots to secure the suture. Also, the chances of slippage of the suture are less. Correct. So the disadvantages of monofilament sutures become advantage of multifilament sutures and vice versa. Correct. So this is again a schematic representation of monofilament and multifilament suture, a closer view. Similarly, another picture showing the same. Okay, the schematic as well as microscopic representation of the same. Clear? Now coming to another category in which sutures are divided, or nowadays the manufacturers are coating the sutures with a lubricant material. So under that, again, we can divide sutures into coated and non-coated ones. So basically, like whatever description I gave about sutures in the earlier slides, the sutures which are multifilament sutures, which have chances of fraying, which have a roughened surface, which have chances of friction when they pass through, those are the sutures which are coated with the lubricant material, okay? So that the passage to the tissues is less and the trauma caused to the tissue is less, correct? So I don't know how much you can appreciate in the picture, but the uncoated sutures do not have glaze, but the coated ones do have this shiny surface and little glaze because of the lubricant that is applied on the surface. So this lubricant makes the passage and all easy, trauma is less, but it makes the knot tying difficult because anywhere the suture becomes, the surface of the suture becomes smooth, knot tying becomes difficult. Okay, so you have to tie multiple knots. Now, based on diameter and thickness of the sutures, we have this beautiful table which is given here, mentioning different sizes of the sutures, correct? Ranging from 10 to 10. And you have to remember one thing, that more the number of zeros, right? Now this, supposing 40, you have 50, correct? The number of zeros, as the number of zeros increase, the suture becomes thinner and thinner, okay? So 50 suture is thinner than 40, 40 is thinner than 30, 30 is thinner than 20, likewise, and so on, okay? So I would like to share this with you all. Like when we used to be in casualties and all, in oral and maxillofacial casualties, we used to make use of 30 and 40 sutures very commonly. And our general surgery and orthopedic counterparts used to make use of 2001 number sutures because they used to deal with non-aesthetic structures, which used to require more, strength of the suturing, stronger sutures used to be required. And our ophthalmology residents, ophthalmology counterparts used to make use of 5060 sutures because there they needed to suture conjunctival tissue and all. Okay, so there thinner sutures used to be needed, right? Correct. Now coming to requisites of suture materials. So if I have to like describe an ideal suture material, I would say that suture material has a very good tensile strength. It is tissue biocompatible, very low tissue reaction. Correct. It has low capillarity. This point I'll be explaining in the next slide. The handling property of the suture should be good. Knotting property should be good, right? And sterilization without property deterioration. So when you have those packaged sutures where the companies or the manufacturers are sterilizing it, after sterilization, the properties of the sutures should not get deteriorated, right? So that is what you call as an ideal suture. There's one point that requires explanation, that is low capillarity. So the explanation is in this coming slide now. Okay. So this is one example that is given, analogous example of suture which is given. Okay. So what is this? There are two containers shown, right? One container has a blue color tinged water, correct? And this is a tissue which is folded and is put in the two containers. And as you can see here, this particular blue color tinged fluid is drawn along the length of this tissue, correct? Similarly, these sutures also have this property of capillarity. Okay, so what happens when the tissue, when the sutures have high capillarity action, or when they have high capillarity, that simply means their tendency to draw fluid towards or along the length is more. I repeat, when I say the suture has high capillarity, that means the tendency of the suture to draw fluid along their length is more. Okay. So is it good to have this tendency of drawing fluid towards their length? So I would say no. Because what happens, the tissue fluid that is present around the tissue, if the suture tends to draw that fluid along its length, what happens? With the tissue fluids come microbial, come microorganisms. So there is microbial invasion also in the wound site. Do we want that to happen? We don't want the microbial invasion to happen in our wound, right? So the capillarity of the tissues, of the sutures should be minimum as possible. It should be minimal, right? I hope this explanation clears that point. Now coming to the parts of suture. So suture can be divided into suture needle and suture thread, right? So starting with suture needle now, these are the parts of suture needle. You have to really pay attention to this because these terms are very confusing. So basically parts of suture needle comprise of a needle point. This is the point where the suture is inserted in the tissue. The A point which is exactly opposite to needle point is the suture attachment point, that the suture is attached. Okay, easy to understand. In between this is the needle body. Okay, in between the needle point and suture attachment point, we have needle body. Now, if I have to draw a straight line joining the needle point and the suture attachment point, and if I have to measure the length of this line, that would be my needle cord length. That would be my needle cord length. Okay. Okay. Now, if I have to draw a perpendicular line from the needle body to this linear, if I have to join, if I have to draw a perpendicular from the needle body to this linear line, okay, that becomes, and if I have to measure the length of that line, that becomes my needle radius. Okay. If I happen to straighten this needle and if I measure the length of this needle, that is my needle length. Okay, so that is my needle length. And if I cut the needle and if I measure the cross section, that is cross sectional diameter of the needle, that becomes my needle diameter. I hope this is clear. This is very, very important to understand the coming slides. Now we come to the different types of needles. So based on the type of suture attachment point that we have two types of needles. We have the eyed one and the non-eyed one. And the non-eyed one is also very commonly called as swaged needle. Okay. So this one is a swaged needle or non-eyed needle. Okay. So what is the difference between the eyed and the non-eyed needle? Eyed needle obviously has an eye through which the suture needs to be passed, right? And the swaged one has a suture incorporated, right? You don't have to pass any suture through it, right? So most of the packaged sutures here are the swaged ones, okay? Have these swaged needles. Fine. The eyed needles, I would say a little disadvantage, as you can see here, is little broader than the swaged one, correct? So the tendency of tissue trauma is a little more in eyed needles than in the swaged needles, okay? Also, it is cumbersome for us to put the suture through the eye, which like keeps coming out again and again. So we have to tie the suture. So it becomes a little cumbersome to use eyed needle. So the usage of non-eyed needle or swage needles is much better. Although, having said that, the expense of the swaged needle is more because we have all the packaged sutures which are available in these non-eyed forms, correct? And all these sutures are expensive. And the eyed ones, you have a silk spool that is available and you have to pass that suture through this eye. So that is much cost effective than the swaged ones. Fine. Now we come to a more technical classification of suture needles. So all years here, and I want complete attention here. So coming to that, based on the longitudinal shape of the needles, again, we divide them into straight, half curve, 1-4-3-8, half circle, 5-8, and compound. So this is a straight needle, right, in the first picture. Why straight? Because it does not have any curvature. Okay, so having said that, do we use these type of needles very commonly in our practice? We don't. Okay, but they can be used and they have been used for extraoral suturing. So we can use them only in the areas where adequate space is there because it does not have any curvature, right? So we need like, broad space. If you have like broad space available suturing, you can make use of these sutures, although not very commonly used, right? So in accessible areas with adequate space, you can make use of these sutures. Coming to the second suture, which is called as half curve. As the name suggests, it is a compromise between straight and a completely curved needle. Okay. So as you can see here, it is straight in the first half of its configuration, and then it very smoothly blends into a curve, right? So that is how it gets its name, that is half curve. Again, it is not very commonly used, although it can be used in certain very technique sensitive procedures like microsurgical cases and all, right? But not very commonly used. Now, very commonly used ones are your 1-4 type of needle, and you have this 3-8 type of needle, you have this half needle, and the 5-8 type of needle. How, from where these names are derived, I will be explaining in the next slide. Okay. Just let me wind up with the last type of needle, that is the compound curvature needle. As the name suggests, again, now what is the meaning of compound? Compound means two or more, correct? So basically, this type of needle has two or more curvatures or curves incorporated in the design. So as you can see here, to have a blend of or a very smooth transition between different types of curvatures, okay, in the compound needle. So this is here, okay, the seventh one, sorry. Okay, so I was talking about where, like from where did we derive these names, 1/4, 3/8, okay. So I'll be explaining in this diagram. So here is this circle which is divided in 8 equal parts, okay. So if I have to involve 8 equal parts, means each of the part is 1/8, correct? Do you all agree with me? So if I have to involve 2 parts, if I have to draw an arc which involves 2 parts of the circle, like this, okay? That is like 1/8 plus 1/8, that is 2/8, that is 1/4. So that becomes my 1/4 type of suture needle, okay? If I have to involve 3 parts, that becomes my 3/8 type of needle, okay? If I have to involve 4 parts out of 8 parts, so that is half of that circle, right? So that becomes 1/2 or half, correct? Half circle. If I have to involve 5 parts, then that becomes my 5/8. I hope now this is very easy to understand. So with practice, merely looking at the needle, you'll be able to understand what kind of needle it is, right? Okay, now little interpretation of whatever I explained in the previous slides. I told you all it is very crucial for you to understand different terminologies associated with the needle. So coming to that, if you have more cord length, okay, this is a basic interpretation to improve your understanding of whatever I taught you all. So if you have more cord length, what does that mean? The needle is bigger in size, right? If the radius of the needle is more, what does that mean? The curvature of the needle is more, correct? It will be more curved. More radius of the needle means more curvature of the needle. More needle length, that means the needle is going to be longer, correct? More needle diameter means that the needle is thicker, correct? Okay, now coming to the execution or like whatever information that I just gave you all, that should be used in your daily practice, right? So basically, with that understanding, now we'll understand like what type of suture based on its different dimensions in what area it can be used, correct? So in restricted inadequate area, we can make use of smaller needle, right, which has less needle length, okay? Adequate space where you have like, sufficient space, adequate space where we can make use of a longer needle or a bigger needle where the needle length is more, right? For superficial tissues, for superficial suturing, where you don't require suturing in the depths, there you can make use of less curved needle, which has less needle radius. Okay, so we'll use the technical term also. So deep tissue suturing will require a more curved needle. What does that mean? More needle radius needle can be used. Is this thing clear? Now coming to another technical classification of needles, which is again a little difficult to understand. Fine. So coming to this, now these are the symbols very commonly mentioned on suture packets. Okay, I'll be showing you all one example also in the later slide. So basically the first needle, this is the cross section. Okay, cross section of the, this is the cross section which is given and this is the point. Okay, fine. So first one is the taper point needle. And what in this particular needle, what happens? From the suture attachment point to the needle point, the needle is progressively getting progressively it is tapering, it is becoming narrow. Okay. Although in the taper point needle, what happens? The point of the suture is very sharp, it is pointed. In the blunt taper point needle, there is progressive tapering, but the tip of the needle is, or the needle point is not sharp, it is blunt. Okay, as the name suggests. The next is taper cut needle. In taper cut needle, what happens? Up to the suture attached, up to the needle point, the suture does not, sorry, the suture needle does not have a cutting edge. But somewhere close to the needle point, it has a cutting edge. Okay, so suddenly, see here the cross is circular, and then here, somewhere close to the needle point, there is a cutting edge that is introduced. Okay, now coming to cutting needle has a cutting edge which is present on the inside of the needle that is facing the concavity of the needle, correct? In the reverse cutting needle, we have cutting edge which is facing the concavity of the needle. That is, the cutting edge is present on the outer side. So it is an inverted triangle symbol, and this is a cutting for a cutting needle. There is a triangle that is given, correct? And then we have a micro point spatula needle in which the point is sharp, although the needle is flattened all over. So if you can see in the cross section, it is more or less trapezoidal, okay, or it is more or less flattened. Is this thing clear? A little what do you say? The use of this needle, little description of that. So cutting needle is very, very sharp, and the chances of tissue pull through or the suture pull through are more. That means the tearing of the tissue chances are more. So I would only use a cutting type of needle in the tissues which are really very tenacious, very kind of firm. Okay. So I would make use of a cutting needle in extraoral surgical cases, correct? In extraoral laceration treatment, right? Reverse cutting needle, on the contrary, can be used intraorally, but I would recommend using them on keratinized tissues only. So for non-keratinized tissues, where the tissues are very delicate and all, you can make use of blunt taper point needles, okay, which can pass through the tissue very easily without traumatizing the tissue. Okay? So the goal is not to traumatize the tissues, right? While suturing, you don't want the tearing of the tissues to happen, correct? Okay. Now we come to different types of suture materials. Now I have to kind of run through this presentation because very detailed explanation is not under the purview of this particular webinar. Okay. Having said that, we'll first start with the surgical gut suture. Okay. Do we very commonly use it? Yes, it is commonly used, especially in the foreign countries. I have a couple of my friends who stay at New York and all, and we very commonly use the suture. Correct? So this is absorbable suture material, and it is obtained from submucosa of the ship or serosal layer of the bovine intestine. It is naturally derived, correct? It is absorbable, hence it is broken down by the body, and this particular suture is broken down by the enzymatic action, not by hydrolysis. Okay. So, as I told in the beginning, hydrolysis, breaking down or degradation of the sutures is more predictable, okay, and it is more gradual also. But enzymatic degradation is little unpredictable sometimes. Okay, so sometimes you can have an issue with this particular suture that it got resolved before the tissue healing happened. Okay, fine. Now, knotting property, yeah, it has very good knotting property. Although the suture becomes brittle when it gets dry. Okay, so that is why plain catgut suture or plain the chromic catgut suture is always available with a liquid in the packet. Okay, so we always have this liquid present in the packet, which has isopropyl alcohol and water content, which helps in keeping the suture hydrated, because we don't want the sutures to get dehydrated and brittle, right? We want them flexible, we want them pliable, correct? That only happen if they are kept hydrated. And they're not there for long-term support. You can never use catgut sutures for very long-term support. There are two types of surgical gut sutures, that is plain surgical gut and chromic. Okay? So in plain surgical sutures, we don't have chromium salts incorporated on the surface. When you incorporate chromium salt on the surface of the suture, that becomes a chromic catgut suture or chromic surgical gut suture. Okay. So plain gut suture absorbs within 7 to 10 days, that is like around a week span, correct? And it is used for rapidly healing tissues, okay? Although it is notorious for causing inflammatory reaction, okay? Chromic catgut sutures, because of this chromium salts which are incorporated on the surface, the absorption is delayed, and also the tissue reaction is observed to be little lesser than the plain gut sutures, okay? And see the absorption time here, it is like 10 to 21 days. So on average, you would say around 3 weeks, correct? So these are the boxes in which chromic and plain catgut sutures are available. So advantages, again, biodegradable, absorbable, no removal is needed, flexible, easy to handle. Aesthetic suturing is facilitated, okay? The disadvantages are they can cause significant tissue reaction, very notorious, okay, for causing tissue reactions, foreign body reactions, less predictable absorption compared to synthetic sutures, okay? Not ideal for critical support structures where you require a lot of strength, of the sutures, you can't use them. And also for critical structures like your cardiovascular surgeries and all, where you're really dealing with crucial structures, you can't afford to use a suture which has unpredictable absorption time, correct? So it is used in following places. You can just go through this. We very commonly use them for cleft surgeries also, like lip clefts, treatment of lip clefts, okay? Because they're very aesthetic. The results are very aesthetic. Okay? Although, yeah, one more problem associated with gut sutures is sometimes the suture ends, when you cut the sutures after the knot is tied, those suture ends become little pokey at times. So you have to advise sometimes anesthetic gels and, uh, um, uh, in those areas when they get pokey and they kind of pierce and, get little kind of irritate that area. Okay, so that is one more problem that is associated with the sutures. Fine. Now coming to the next suture, that is your Vicryl suture. So it is a synthetic absorbable braided suture. Now braided means it is a multifilament suture, correct? Now it is absorbable and it takes around 56 to 70 days. That is approximately on average 2 months for it to like totally degrade. Okay. Now there's one variety available in the market these days, which is called as Vicryl Rapid, which takes around 2 weeks for complete degradation. So it like degrades a little faster than its older counterpart. Fine. Then it is a multifilament suture and most commonly it is a braided one, correct? And because it is a multifilament suture and because it has a rough surface and because it can cause little trauma because of that rough surface, we have these coated versions available for Vicryl coated as it is called. Okay, a smooth passage and which reduce the tissue trauma. Now, absorption is much predictable. It is not unpredictable like surgical gut suture. Okay, so they will never disappoint you. They will never get resolved before time. Okay? Now, minimal inflammatory response because they're synthetic sutures. Always remember, natural sutures will inflict more foreign body reactions than the synthetic ones. Okay, correct. Now, coming to, I'm sorry. Yeah, the advantages. So, no suture removal is needed because they're absorbable ones. Healing is predictable. They are very strong and secure. Knots can be tied. The tissue reaction is minimal to negligible, correct? Coated variety is also available with these sutures. Disadvantages are they can trap bacteria because they are braided ones, are expensive than catgut and silk sutures, okay? And although, you have the coated varieties and all available, but they will never be as smooth as monofilament sutures like monocryl, okay? These are the uses. Now coming to the next suture, that is monocryl suture. It is a synthetic monofilament absorbable suture and it gets absorbed in about 3 to 4 months by the process of hydrolysis. So very gradually the suture gets absorbed. Okay? The smooth surface will obviously minimize the bacterial adherence because it is a monofilament suture. The tensile strength is good. I won't say it is excellent, but it is decent. It is real. It is good. Okay. Minimal tissue reaction because again it is a synthetic suture and it is very soft and pliable. Yeah, that is one thing. The handling because it is pliable is good. Also because it is monofilament, multiple knots have to be tied, right? So advantages: smooth tissue passage, minimal bacterial adherence, predictable absorption, very soft and flexible, and there is no need for suture removal, right? Disadvantages: the tensile strength is not excellent, right? So for prolonged healing wounds and for healing for wounds which require longer support and really, uh, long healing times, there you can't use these monocryl sutures, correct? And they are more expensive than catgut and silk sutures again. And they're not ideal for bone grafting or high tension closures because they are not very strong sutures, okay? So these are the uses. Heading to our next suture, that is your PDS suture. So this PDS suture is a synthetic monofilament absorbable suture. So absorbable, so it degrades in about 80 to 210 days. That is approximately 6 months around. Yeah. So one thing I have to mention about the sutures, they have really, longer resorption periods. That means they resorb after a very long duration. Okay. So you can really use them in the tissues which require long time to heal. Okay. So these are monofilaments, so smooth surfaces, very good tensile strength that they have. Like almost 50% of the tensile strength is retained after 4 weeks. That is after almost a month. Still more than 50% of the strength is retained. Okay, that's a very good property. The tissue reaction is minimal again because they are synthetic. Low absorption. So prolonged wound healing is promoted. Prolonged wound support is promoted. Okay. Now coming to the advantages again, long-lasting tensile strength. These are monofilament sutures, so bacterial infection is less. Smooth tissue passage, predictable absorption, less inflammatory response. Disadvantages you have to remember is they are little stiff and they are less flexible than your monocryl and all the other sutures. They're a little less flexible. So they are a little stiffer. So it becomes a little difficult to handle these sutures because of their stiffness. Also, they are more expensive than Vicryl sutures also, more expensive than Vicryl. Okay? The absorption is slow, very slow. So for fast healing tissues, you obviously can't make use of these sutures, correct? You would not want to use these sutures for fast healing ones. These are the uses. Coming to the next suture, that is silk suture, which is very commonly used in dental colleges. Okay, favorite suture because it is not expensive. Okay? Non-absorbable multifilament and natural surgical suture it is. So it is natural suture, so it is naturally obtained from silkworms. Okay, and it is very commonly coated with wax or silicone so that the fraying of the sutures is less, and likewise the tissue drag and tissue trauma is also reduced. Okay, because of that coating. Correct. Now coming to absorption, they are non-absorbable, but these silk sutures they do degrade. After like several months or like within a year, it gets completely degraded. Although it takes several months. That is why it is categorized in non-absorbable sutures only. Okay. Tensile strength is decent. It's good. Knot security is very good. Okay. No, knot tying is very good. Tissue reaction is moderate. It is not very high as surgical gut sutures, but definitely some inflammatory reaction you can expect with these sutures, okay, in some patients. Advantages, excellent handling and knot security is seen. Flexibility is really good. And most important property of this is it has this dark black color, okay, which makes these sutures easily visible. So during suture removal, it becomes very easy to appreciate these sutures in the oral cavity, correct? Because of their contrast color. Disadvantages, tissue reaction. Yes, they can promote inflammation. Bacterial wicking, which is nothing but they have high capillarity action. So the tendency of these sutures to draw this tissue fluid are more, and likewise, introduction of the bacteria to the wound area is more, right? And all the more they are multifilament also. So in the interstices and in the crevices, you can expect bacterial harboring. Okay. Now coming to they are non-absorbable, so they require follow-up removal. Correct. So these are the various uses. Okay. Now coming to the next suture, which is polyester suture. So it is a non-absorbable synthetic multifilament suture. And I would like to mention right in the beginning that it is not very commonly used in dental practice. Very rarely used in oral surgical practice also. Okay. So, but I would still like to shortly describe it. Material, it is a synthetic polyester, as the name suggests. It is a non-absorbable suture. It is available in braided forms, and mostly it is coated with either silicone or Teflon. PTFE is nothing but Teflon. Tensile strength is really very good. Okay. So knotting property is also very good, and tissue reaction is minimal because again it is synthetic. So advantages are the tensile strength is really good, as I mentioned in the beginning. Minimal tissue reaction, knotting property is good, and it is resistant to degradation like silk. Right. Disadvantages, multifilament structure can promote bacterial adherence. So this coating, that helps in reduction of this bacterial adherence. Other than that, they are less flexible than silk sutures and they can cause discomfort because they're little, like kind of stiff and little less flexible and less pliable than silk sutures. Therefore, they can create a little discomfort if they remain in place. So, as I mentioned in the beginning, sometimes used for securing flaps, very rarely. Okay, when you have other better options available, you don't have to go with these very strong sutures, which can be used in other medicine fields like your general surgery, orthopedic surgery, and all where they are very commonly used. Okay. Now coming to our next suture, that is your Teflon or PTFE suture. So it is a synthetic non-absorbable monofilament suture. So it has very good biocompatibility because it is a synthetic suture. It is biologically inert. It is very soft and flexible, really very soft and flexible. It has this non-wicking nature. That means the capillarity of the suture is very low. The tensile strength is very good. Handling is very good. Although the knotting property becomes little difficult with Teflon sutures because it is a monofilament suture. So little slippage chances and all of those increase. Minimal tissue reaction and the surface is smooth, so no bacterial adherence. Correct? The disadvantage of the suture is it is expensive. It is like expensive than the other sutures that I spoke about, and the availability is limited. Okay, usually, it is not available with all the manufacturers. Okay. Okay. Now, these are the various uses of these sutures. Now coming to the steel wire. So yeah, these type of sutures are also available, although not again very commonly used in. So in oral and maxillofacial surgery, we make use of wires and all for arch bar fixation, for intermaxillary fixation, for fracture fixation. Although we don't have these sutures available, these I'm sorry, steel sutures available. Okay, steel wire which is connected with the suture needle. We don't have these available. Okay. But it is very commonly used in orthopedic surgeries. Okay, so orthopedic surgeries and also in open heart surgeries. So material used is stainless steel, very high tensile strength. They do not degrade in the body, right? So they provide permanent support, correct? Not security. You can't actually tie good knots because it is a very stiff material, correct? It is radio opaque. The only suture which is radio opaque is this. So that is steel wire and infection resistant because it has extremely smooth surface, right? So coming to advantages, high tensile strength, resistance to infection can cause patient discomfort. Okay, if it is used like anywhere in the oral cavity or something, if we tend to use it, it will cause a lot of discomfort. It is more difficult to handle because of its rigidity, right? And requires removal. So even for arch bar stabilization cases and all, when we make use of wires, right, it becomes difficult to manipulate those wires. Okay, you require a lot of strength and a lot of expertise to deal with them. Correct? So uses, as I mentioned in the beginning, for sternal closure after open heart surgery. So we have this osteotomy which is performed in the sternum to gain access to the heart. And after the surgery is performed, open heart surgery is performed, we need to uh, close the sternum back, right? For that fixation, we can make use of these sutures. So fracture fixation, orthopedic cases, also tendon and ligament repairs, we can make use of these sutures. And dental and maxillofacial surgeries of the jaw stabilization, yeah, I mean, we make use of wires, but not wires with sutures, with the suture needles. Okay. Now coming to our next suture, that is nylon or epilon type of suture. So it is a synthetic non-absorbable mono or multifilament. Okay, but commonly available in monofilament form. Okay. So non-absorbable again. The tissue reaction is minimal. The tensile strength is good. But it is slightly less than steel wires. That is obviously any suture will have tensile strength which is going to be less than wires. Correct. Now, elasticity is good. Now, one thing I would like to mention, unique property of the sutures is if you stretch these sutures, these are nylon sutures. Okay, so if you stretch them, they stretched. Okay, so they can stretch slightly to accommodate the swelling and the movement also. Even if you stretch it with the fingers, they tend to increase in length. Okay, so knot security, it requires multiple knots for stabilization. Okay, otherwise there'll be slippage of the knot and opening of the suture. Now coming to advantages, strength is good, elasticity is good, and tissue reactivity is minimal. Disadvantages, they become difficult to handle because these sutures have something called as the memory effect. That means what happens once you manipulate them in a particular way, they stay in that format. It is very difficult to bring them into original format again. So the memory effect make them little difficult to handle sometimes. Not really very, what do you say, discomforting disadvantage. It requires multiple knots for security. And in our practice, we used to very commonly use these sutures for extraoral suturing. Okay? Very commonly used suture in oral and maxillofacial surgery for extraoral suturing. Okay? It is affordable also and easily available also. So we used to use this ethanol sutures for extraoral skin suturing. Okay, and for intraoral cases, we used to very commonly use vicryl sutures. Okay. Now coming to the last suture, that is our polypropylene suture, also called as proline suture, very commonly called as proline suture. The material, polypropylene, absorbability, non-absorbable ones, right? So they remain in the body unless you try to remove them out. Structure, it is a monofilament suture. Tensile strength, yeah, it is good, it is high. Reaction, tissue reaction is minimal or nil because it is biologically inert. Color, it is available in this beautiful blue color, okay, bright blue color. And sometimes it is also available in a colorless format, okay, which is like clear suture, okay. Coming to the advantages, tissue reaction is minimal because it is a synthetic material used. Tensile strength is good. Monofilament structure it is, so it has a smooth surface. Biocompatibility is good. Non-absorbable, so they do not get, they do not get degraded with time. They're flexible and pliable. Okay, they're not stiffer. Okay, they're very easy to handle. Proline sutures. Disadvantages: Slippery surface. Yeah, since they are monofilament kind of sutures, the surface is little slippery, so little skillful handling of the sutures is required. Knot security is an issue again. They're non-absorbable. Suture extrusion risk is also high in these sutures because they remain in place, and the cost is also high. Okay. So these are the uses of this suture. Now, as I mentioned in the beginning, this is the box of suture that is given. Okay. So there are certain, specifications that are given on the suture packets and the suture boxes, which you all should make a practice of reading. Since now you are well versed with all the terminology part of the sutures, you should be in a position to read and understand the specification. So related to suture needle, we have 3/8 type of needle, as it is mentioned here. There's one more detail mentioned, that is needle length, which is given here as 16 millimeters. That is about 1.6 centimeters. Correct? It is mentioned that it is a cutting kind of needle. It is they've given a symbol. Sometimes only symbol is given and the cutting is not written. Okay? But most of the times cutting is also written and the symbol is also given. So we have here a triangle that is given, and also we have given in writing that is a cutting type of needle. Okay? So that was about suture needles. And there is a picture also which is shown here, which clearly shows it is a 3/8 type of needle. Fine. Now coming to suture thread, they've given that it is a silk braided suture. Okay, they've given silk, and they've also mentioned that it is a braided kind of suture. It is a 3/0 suture, non-absorbable one. They've written, right? Now, what is this? What is the meaning of 2 metric? Okay, this is something that is not taught, right? So the meaning of 2 metric is, the metric term gives us diameter of the suture, diameter of the suture thread. We spoke about diameter of the suture needle, right? So what about suture thread? So diameter of the suture thread is given with the help of this term, that is metric. Okay. So 2 metric is basically 0.5 millimeters is the thickness. So basically 1 metric is 0.4 millimeters, 2 metric is 0.5 millimeters, 3 metric is 0.6 millimeters, and so on. Okay. Now I hope you'll be in a position to read the suture boxes and be able to understand what type of suture it is. Also, they have mentioned 90 centimeters. 90 centimeter is the length of the suture thread. Okay. Fine. Now, these are the principles of suturing. Now, discussing in depth about the principles of suturing is not under the purview of the seminar. Although it requires detailed explanation, but I think we'll be able to cover it up in the workshops that are being held, because otherwise it will extend like anything. Okay. Okay. So now the armamentarium that is used, again, I'll go through this really very fast. I have to like run through the slides. This is the needle holder. Okay. So which has a jaw, which has jaws, which has joint and a shank and the ratchet, right? Again, I won't be able to explain in depth about each of this. Tissue holding process, we have two varieties, that is tooted and non-tooted. Okay. Now, surgical sutures, these are the different parts, the overall parts of the surgical sutures. And we have different types of surgical sutures available. Okay, we have these beautiful design sutures which increase the accessibility. Easy handling is facilitated. We have these Castroviejo kind of sutures. We used to use these sutures for suturing very delicate areas. We've done ophthalmic suturing and all also with these sutures. Okay. With these needle holders, Castroviejo needle holders and Castroviejo scissors. Okay. So for very delicate tissue suturing, we can make use of these holders and scissors. Okay. Now coming to the suturing techniques. So I would be describing these suturing techniques. Coming to the first one, simple interrupted suture. As you can see in the picture here. Okay. So these are the sutures, separate sutures are placed. That is why the name suggests interrupted. Okay, you don't have one single suture which is passed, but you have multiple interruptions between these sutures, correct? So basically, what is the suture? I'm sorry. So basically, this suture is one of the most commonly used techniques, favorite technique, basic technique, okay, which I guess everybody should be knowing this technique and everybody would be knowing this technique. So the wound approximation is very precise and it is very good. And if one suture fails, you don't have to worry because there is another suture, another multiple sutures which are taking care, and they will keep the wound approximation in place. Disadvantages are it can be time consuming because every time you have to put like one suture, you're tying a knot, then you're going to the second one. So it is really time consuming. And also the suture material needed is more because you're putting multiple knots. For each suture, you have to put 3 knots. So more suture material is definitely needed. Coming to the second type of suturing technique, that is simple continuous suture. So here, what we do is we have these continuous, tissue bites which are taken without putting multiple knots. Okay. So basically, this is a suturing technique in which the wound closure is particularly for, large straight incisions. We make use of these sutures, and it consists of uninterrupted stitches, and they're given in a continuous manner. So I would say it is very quick and efficient because you don't keep on interrupting it, correct? Wound approximation is good, it is decent, and less suture material is used, right? But the disadvantages is if in any one part of the suture breaks, the entire suture is going to come out and there will be the opening of the incision, right? Less precise tension control. So always, you make the assistant or you hold it on your own. Whenever you give, whenever you take bites to the tissue, you have to keep tensing that suture, okay? Because we don't want any part of it to become loose, okay? Because anywhere if it gets loose, then the entire suture is going to become loose. And the approximation of the wound or that incision is going to go for will go for a toss after that, correct? So continuous locking suture is where it is similar to continuous suture, but what you do is this variation of this continuous suture where each loop is locked by passing the needle through the previous stitch. Okay, so it is stronger than the simple continuous suture. It will distribute the tension more evenly than the continuous suture. The risk of dehiscence is reduced in this continuous locking sutures. Little modification of this continuous locking of the continuous suture is this continuous locking suture. Although the disadvantages would be they can cause puckering of the skin if it is too tight, and it is a little difficult to remove. When you talk about suture removal, it becomes a little difficult to remove these sutures because you have this locking thing and all involved. Okay. Now coming to mattress sutures, so they are broadly divided into horizontal mattress sutures and vertical mattress sutures, right? Horizontal also we have two types, that is your continuous suture and your interrupted suture. Vertical mattress suture is again second type of mattress suture where you can see is again of two types, interrupted and continuous. Now I want you to understand this point. In vertical mattress sutures, the sutures are perpendicular to the incision line. On the contrary, in horizontal mattress sutures, the sutures are always parallel to the incision line. Okay. Now about these mattress sutures, the vertical mattress sutures, they provide excellent wound eversion, and especially, for deep wounds or the wounds that, we expect that we would be closed under tension, we prefer using, especially the deeper wounds, we'll prefer using vertical mattress sutures. Horizontal mattress sutures are ideal for fragile skin or wounds with significant tension, and where you have little broad spanning areas, you can make use of horizontal mattress sutures. Now, next we come to figure of 8 suture. Now, figure of 8 suture is also very commonly performed in dentistry for, approximation of post-extraction sockets. So, you have this you pass the sutures through these papillae, and after suturing, it somewhat gives us a figure of 8 appearance, right? And not only that, we also make use of these sutures in surgical practice for achieving hemostasis, okay? By passing it over the vessel and by squeezing the vessel in between the suture. Now, figure of 8 suture is again a technique which is very commonly used for achieving hemostasis for surgical wound closure and orthopedic surgery, as well as in oral and maxillofacial surgery. And it is used also for tendon repair, wound closure, and also used as bone anchor sutures also. Okay, now what is it? Again, not in the purview of this webinar here. Subcuticular suturing is again of two types, that is interrupted and continuous. And as the name suggests, cuticular. What is the meaning of cuticle? is skin or covering, right? Cuticle means covering or basically skin. Sub means under. So this suture is not done on the skin. Okay. So the bite is not taken on the skin, but it is taken in the sub mucosa or in the sub mucosal layer, or either it is in the subcuticular layer, that is below the skin or below the mucosa. As you can see in this picture, right? The skin is not involved, epithelium is not involved, but the submucosa, underlying submucosa or the subcuticular area is involved. Yeah. What is the benefit of this? So when you see it externally, what happens? The wound edges are approximated, but you won't be able to see any suture from outside. So 100% you can deduce out of this is that they have a very good aesthetic benefit. So when you need aesthetic suturing, especially of face and all, we very commonly make use of subcuticular sutures. Okay. So for cosmetic surgeries, for facial wound surgeries, and for pediatric surgeries where we don't want a lot of scarring and all to happen, we would go with the subcuticular suturing. Now coming to the last type of suturing technique, that is our sling sutures. Now these sling sutures are also of different varieties. We have continuous sling suture, we have a double sling suture, and we also have something called as interrupted sling sutures. So very commonly these interrupted sling sutures are used, and also double sling sutures. So basically, these continuous sling sutures are used for securing flaps around the teeth. Very common, for periodontal surgery. We have used it very commonly for securing flaps around implants, where especially when you have, a lot of bone grafting and all done, you don't want implant exposure to happen. So when very precise flap attachment is needed, very precise flap approximation is required, or where you want the flaps to settle in a particular position, precise positioning of the flap is needed. That is the right term. Okay? We can make use of sling sutures. Correct. So applications, periodontal surgery for when you have those coronal advancement flaps and all periodontal surgeries, where you want really the positioning of the flap is absolutely important. Even for implantology, we make use of sling sutures. Coming to the knots, we have two different types of knots, that is surgeon's knot and square knot, out of which surgeon's knot is very commonly used. So basically in the surgeon's knot, the first step, or I would say the surgeon's knot is all about, you have two throws in the clockwise direction, and then you try to secure a knot, that is the surgeon's knot. And then you also have a safety knot to facilitate the safety of the surgeon's knot, and we don't want it to open. Therefore, we also have a safety knot which comes into picture. Now, other than these suture materials, we have certain mechanical wound closing devices that are very commonly used. Like you have liga clips. As the name suggests, they're used for ligatures. Yeah, they are ligature kind of clips which are used for ligating blood vessels. Okay, so when you want, when there's a lot of hemorrhage, or not even in, usually we use them in our neck section cases, for onco cases, when we need to sacrifice a particular vessel, what we do is we tend to put ligature clips, and we sacrifice in between. We have to cut the blood vessel, and we sacrifice that blood vessel along with the lymph nodes. Okay. Now the surgical staples also very commonly used. As you can see here, it is similar to the normal staples that are used on papers, right? So these surgical staples are used again in orthopedic surgery and also in oral and maxillofacial surgery. So we have done a lot of suturing in neck dissection cases. Okay, so what we do is we do some subcutaneous suturing, and then the skin suturing is facilitated with the help of these surgical staples. It is very quick. The removal is also quick, and the putting basically you can put these surgical clips also, staples also faster. Okay, so it will not, it doesn't take a lot of time, especially when you have very large sutures to be done. You can make use of these surgical staples where the aesthetics is not the main concern for us. Correct. Nowadays, the companies are also coming up with these tissue adhesives, cyanoacrylate and all materials are used, where you have these available either in tube forms or in ampules or these bottles. Okay. So basically, this glue is put along the edges of the incision, and then we can just approximate them, and they get fused. Okay. Although some cases have reported some foreign body reaction to these glues, so hence not very, very commonly used. Okay. Now, sturdy strips, okay, even we used to use that very commonly, especially when you have very small, very small incisions, very small wounds, okay, and which are usually not infected, non-infected, small wounds, straight line wounds. For those wounds, we can make use of these sturdy strips. So what you do is you just bring the wound edges closer and you put this adhesive tapes on top of it. Okay? So for small, very clean wounds, you can make use of these sturdy strips. Now about complications, again, in-depth explanation of the complications I won't be able to do here. I'm really sorry for that. But I would like to just touch through this. Infection is a very common complication that can happen related to sutures. Dehiscence is nothing but opening or reopening of the previously wound closed suture. So why that happens, what can be done, all of this we can't cover here. Then scarring or keloid formation, again, very common type of complication that happens, especially when there is a lot of inappropriate pressure that is applied during suturing. Necrosis, again, when it is closed with under a lot of tension. Suture granuloma is also not very commonly, I would say, but can occur. Okay. Allergic reactions, delayed healing, right? Because the suturing technique was inappropriate. Foreign body reactions, yes, very common. As I mentioned in the beginning, surgical cut is notorious for it, right? Very commonly seen. So here I conclude my webinar of suturing in dentistry, oral and maxillofacial surgeon's perspective. Okay, so I have shared my knowledge of suturing with you all, the suturing, various sutures that I use and various suturing techniques that I use. Although I had to run through some slides because I couldn't take a lot of time, right? But in the upcoming workshops, maybe I'll be able to help you all with the techniques in depth, better understanding of techniques and better understanding of complications and how to combat those complications in our practice. Okay. So I would like to conclude by saying suturing is very, very important, and suturing is a technique where the precision meets healing. So thank you very much. So I hand over my uh, overall thing to Dr. Dole. So, sir, kindly proceed with the conclusion of the webinar.
Thank you, Dr. Shruti, for a wonderful presentation. It was very, very, very
Pleasure
fantastic.
was all mine. Thank you.
Any questions? You can put it in chat box, or you can directly ask to the mentors students. Anyone has any question? Dr. Manik Joshi, who is from Pune, wants to say thank you so much, Doc. It's a lovely presentation. Lovely
Thank you
webinar.
very much, Dr. Manik. Thanks a lot.
Congratulations to you.
Means a lot.
Okay, I
Any
think
questions?
no questions. Any questions? To conclude, Dr. Prashant Agi wants to say thank you, ma'am. Informative webinar.
Thank you. Thank you very much, Dr. Prashant.
Dr. Prisha Nandiwal, Dr. Mohammed, Dr. Khushbu, and Dr. Rafi. These people attended. Totally, there
Okay.
were.
Thank you, Dr. Prisha. Thank you for the feedback.
Thanks a lot, everyone. So let's conclude it and let's meet in the next webinar. You have that course. Can you precisely tell about the course, Dr. Shruti? You have a course.
Yes, Dr. Sudhir. So basically, we have planned a workshop in which I would be conducting not only in depth the seminar regarding this suturing techniques, but also different suturing techniques would be taught, and various sutures would be given for our students to handle also, and they would be made to suture on the suturing pads and all. So they will be able to have a lot of hands-on of these suturing. So they will exactly know what are the various techniques that are used in the surgeries in dentistry. So that will be conducted on, we have planned it to be around like 24th of April.
Okay.
So we'll give all the information regarding that on the, I think I've already shared a brochure on the group. So you all can just go through that brochure.
Fine, please do that. So let's meet in the next webinar, which is on 13th of April by Dr. Garima Polkar. See you again. Thank you. Thank you, doctor.
Thank you so much.